Eye bags. Already had surgery once. Looking for other options. I had both upper and lower eyelid surgery about 8 years ago. Never really happy with lower lids. Over the past couple of years, bags are worse. I was told it was fat, but I'm not sure. They are worse some days than others. They never go away. I don't want to have surgery again if it won't help. Looking for other options.
Thank you for your question. You submitted 2 photos and you stated in your question that you had upper and lower eyelid surgery performed approximately 8 years ago, that you had never been fully happy with the results, and you're noticing that the bags under your eyes continue to get worse. And you stated at the end of the question that if you don't want to have surgery again if it isn't going to be of any help. Well, certainly I can probably assist you with your question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculoplastic and oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. So eyelids is one of my areas of focus and specialty. And revision eyelid surgery has been one of my main areas of specialty for the past 20 years. So to help you understand a little bit about what your situation is, let's start by first defining the anatomy, because the question of solution is always contingent on the definition of what the problem is. So if there's a doubt in your mind about your first surgery where you felt you weren't fully satisfied, that there were still bags under your eyes, well, most likely you are right that there are bags, and that over time those bags have gotten naturally worse. Now what those bags are is fat, and we use the term herniated fat. It's fat that is around the eyes that pushes forward, resulting in this puffy appearance. A way to help you confirm that you can do this yourself is to have someone take a photo of you looking straight, and then without moving your head, look straight upward. And when you look straight up, the fat pockets in the lower eyelids tend to protrude even more. Now what you can also do, and I think on the right eye it's particularly obvious, is that if you look up and towards the opposite direction, so on your right eye you will look up to your left, then that fat pocket will protrude even further. So it is not uncommon for, after eyelid surgery, for there to be residual fat, particularly in the outer part of the eyelid called the lateral fat compartment. Now with that being said, then it stands to reason that surgery is appropriate, because otherwise you're not going to have a non-surgical solution that's going to accomplish what you want to accomplish. So most likely you will need some type of surgical solution to address the fat pockets. You should first establish the diagnosis. In addition, it might be worth considering the support structure of your lower eyelid. If there's any issue with sagging or with resilience, then that should also be addressed. As a specialist, I get to see a lot of complications, and I see patients who come with their eyelids pulled down. They come from around the world, and we do all kinds of very extensive procedures to restore the integrity of the anatomy in order to get the eyes to function properly and to look better. So I think that's an important thing to factor in. So my recommendation is you meet with qualified, experienced cosmetic surgeons. I'm naturally biased towards specialists. This is in distinction, or to distinguish from general plastic surgeons who don't specialize in cosmetic eyelid surgery, only because this sounds like something that requires a little bit more detail and attention and some experience in order to get a good result and for you not to be disappointed. But I think that you should meet with specialists who perform a lot of lower eyelid surgery and are able to handle more complex reoperative surgical procedures. So, and once you meet with doctors that are able to, that you feel comfortable with, move forward. I think that lower eyelid surgery in particular has such a nice impact on overall facial appearance that it would be nice for you, I think, to get past the initial suboptimal levels of satisfaction that you had from the first surgery by getting something done which really addresses the problem more definitively. So I hope that was helpful. I wish you the best of luck, and thank you for your question.